legs all this month. We're taking time to help you get to the bottom of that pain and discomfort if you should have it in your legs.
Last week we debunked some of the myths about what causes those conditions, like crossing your legs or wearing high heels. This morning we're delving into what actually is behind those problems. Dr. James St. George is joining us once again from the St. John's Vein Center. Now, thank you so much for being with us again.
Thank you, Nick.
Last time we talked about some of the myths, we debunked a lot of those, but what actually is spider veins? What causes it? What is it all about?
Well, you know, there's not a short answer to that, but we have two sort of conditions with spider veins. We have the cosmetic that we see we will see in a picture. Here we have a slide. We show that on the right we see some spider veins. And we have a little blue vein leading to those spider veins. That's a feeder vessel called a reticular vein. And in many cases, these are cosmetic. However, they may be a sign, or the tip of the iceberg, if you will, of something more serious. And that's a condition where patients may have a medical condition that needs treatment. That condition is called venous insufficiency.
Okay, and at what point in time do you know if you have venous insufficiency? What are some of the things that you should be on the lookout for with your own legs to know?
Well, it's something that will get worse with age.
Okay.
It's something that takes many years to develop. You don't wake up one morning with venous insufficiency. It's taken 20 years to get to this point, or longer, after pregnancy, after you get into your 40s or 50s. Patients will have swelling. They will see, in this case, we have a left leg and ankle that's markedly swollen.
Yeah, we have the graphic that's on top of it, but you can really see between the right leg and the left leg.
There we go.
There you can see how the ankle is really
Exactly.
noticeably swollen.
And many patients don't even realize they have this.
Of course, well, exactly, because I mean, I'm sure there are a lot of people that until a friend tells them, they have no idea. And then what are we looking at here?
Well, here's spider veins in the ankle. However, this is really a sign of the more medical condition. You see some brown darkening around the ankle, and you'll see this in the calf as well. That's called hyperpigmentation, and that is a sign of many, many years. Here's a case where patients have dry skin, otherwise known as eczema, also a sign of advanced venous insufficiency.
Okay, so what are some of the symptoms then that people should be on the lookout for in addition to this? And this is what you...
Here's everything.
Everything.
This guy has everything.
Yeah.
He's got massively swollen legs. He's got the eczema. He's got severe hyperpigmentation. I see these people on the beach, and I just want to stop them and say, I need to help you.
And imagine, and that looks pretty painful,
it
too.
is.
And so you don't have to deal with that pain. So let's...
Exactly, and patients will have symptoms from this. Their legs will feel tired, they'll feel heavy. They may wake up at night with leg cramps. Restless legs, this can be a cause of significant restless legs, more than just, quote, restless leg syndrome. They may have itching, burning, tingling, numbness of their skin.
Now, what is happening inside that causes this?
Well, that's really the bottom line. So let's talk very quickly about that. We have patients, when you walk, you use your muscles, and they squeeze the blood up the leg, and they help propel it up back to your heart. And that's what the legs have to do, is get that blood up to the heart. So walking's important. We have a graphic here that shows the real culprit, and that's gravity. Gravity wants to pull that blood back down to the lower legs. So age, hormones, pregnancy, all these things lead to the vein dilating. It gets wider. The veins have these one-way check valves called, they're valves, and they prevent the blood from falling back down the leg. On the far right, you see a schematic that shows that valve isn't meeting. It's not sealing the vein, so the blood falls down the leg. And over the course of the day, your legs start to swell, they get tired, you will have burning sensation, achiness, you'll wake up at night with a cramping. That's from all day of that blood pooling in your lower leg, from it falling down into your lower leg with gravity. And that's really the bottom line with this condition, is the valves don't work.
And if you're at home right now and you're thinking, man, you are just summing me up and my problems to a T, what should you do about it? And why is it so important that people at home, if they have this, address it?
Well, it is a chronic medical condition. It's in a potentially serious medical condition. So it's important to be treated, more than just how it looks. So, the first thing to do is to see a specialist, and we will perform a screening ultrasound, and we can tell in a matter of minutes what's going on. But, a lot of folks feel that this is just a normal part of aging. Nothing could be further from the truth.
And that's not true.
It's abnormal at any age to have swollen legs, painful legs, tired legs. There's no reason for that.
So if somebody has any of those symptoms, or they're seeing little spider veins or anything along these lines, they should call you, because you guys have something special going on.
Exactly. We can tell in a matter of 10 minutes and a quick screen that if you have this problem. There's absolutely, our motto is great looking and great feeling legs at any age.
And let me
And
say
free.
I was going to say
And
this,
free screening. Thank you very
which
much.
is really helpful because
Yes.
if you don't want to worry about the general visit and whatnot and the copay, you don't have to worry about it because it's free. So you can go in and get all of your answers, all of your questions answered. There you go. Trying
And
to
get rid of
it
them
out.
once and for all. Thank you very
Trying to
much.
get it out. Thank you so much.
Thank you
Dr.
very
St.
much,
George.
guys.
We appreciate your expertise in all of this, and we want to thank the St. John's Vein Center for sponsoring this segment.
Remember, there's no charge for an initial consultation and screening ultrasound. Just call 904-402-VEIN. That's 8346, or log on to St. That's stjohnsvein.com.